I'm gonna wash my hands to reduce the risk of infection. Okay, knock, knock. Hi, I'm Destiny Barnes. I'm gonna be your nurse today.
Nice to meet you.
Nice to meet you. Before we get started, can I get your name and date of birth, please?
Jane Doe 83097.
Okay, nice to meet you, Miss Doe. So today it looks like we're going to be doing a full head to toe assessment on you. It should take about 20 minutes or so. And I want to assure you that your privacy will be maintained the entire time, and anything that we discuss or talk about is all confidential.
Okay.
Do you have any questions about this?
No, ma'am.
Okay. If you feel like you have any questions or anything comes up, just go ahead and ask throughout this assessment, okay?
Okay, thank you.
All right. So before we get started, I want to give you 4 words to memorize.
Okay.
And then after, I'm going to ask you a series of questions, and then you just tell me back what those 4 words are, okay?
Okay.
So the first word is going to be rain.
Okay.
And then the second is apple.
Okay.
The third is tree.
Okay.
And the fourth is pen.
Okay.
Okay. All right. Do you know where you're at right now?
The UALR library.
Okay. And what month is it today?
May.
Okay. Do you know why you're here?
For a head to toe assessment.
Okay, great. Do you have any allergies?
Not that I'm aware of.
Okay. What did you do last Tuesday?
Class.
Okay. And where were you born?
Lebanon.
Okay. I'm going to have you pick this pen up with your right hand,
Okay.
draw a heart, and then move the pen to your left hand once you are done. Okay, perfect. And have you had any thoughts of harming or killing yourself or anybody else?
No, ma'am.
Do you feel safe at home?
Yes, ma'am.
And overall, in the last 2 weeks, how has your mood been?
It's been really good.
Okay, great. Do you remember what those 4 words were?
Rain, apple, tree, pen.
Yes, perfect. So overall, it looks like your mood is upbeat, your facial expressions are appropriate for our conversations, you're dressed appropriately for your age, you're well groomed, and your speech is very clear. Okay, so I was going over your vitals, and everything seemed within the normal range, but I'm just gonna discuss that with you.
Okay.
So your blood pressure was 123/62,
Okay.
your temp was 98.4, your pulse was 72, your SpO2 was 99, your respirations were at 16.
Okay.
Is that about your baseline?
Yes, ma'am.
Okay. And are you in any pain today?
No, ma'am.
Okay, if you had to rate it 0 to 10, what would you say?
A 0.
Okay, great. Okay, so I'm going to just do like overall skin inspection. I don't see any lesions or lumps present. Your skin tone is pale with lots of brown freckles. You have 2 tattoos on your left arm with a rose and a mother baby tattoo, and then on your left arm you have floral tattoos.
Yes, sir.
Okay, so I'm going to just feel your skin. Your skin is warm and dry. And your nails. Look at your nails here. They are trimmed, convex with no clubbing. And your toes are trimmed with no clubbing on the toes. Both your nails and your toes had a cap refill within 3 seconds, which is really good. Okay, and we're going to look at your head. All right, so overall your head shape and your skull is normal cephalic. And then I'm just gonna glance at your scalp here. Do you feel any pain or lesions?
No.
Okay, there's no lesions present, no parasites. Your scalp was dry. Your hair is red in color, shiny, thick, straight hair, and there's no irritation in your scalp.
Yes, ma'am.
Okay, your face overall is normal skin tone with the rest of your body. You have freckles. Your eyes are in the upper third of your face. Your nose is midline, and your mouth is in the lower third. Your neck is midline, and I'm just gonna go ahead and check your carotid real quick. Okay. All right, And then I'm going to listen to it, and while I listen, I'll have you hold your breath, and I will go ahead and feel for that. Okay, go ahead and take a deep breath and hold. Okay, you can breathe. Take a deep breath and hold. Okay, your carotid has a regular, strong rhythm with no brutes present. And I'm going to now just check on your lymph nodes here. So you have your preocular, your posterior ocular, your occipital, your tonsillar, your submandibular, your submental, your superficial cervical chain on both sides, and then your deep cervical chain, and then your posterior cervical, and your supraclavicular. Okay. Did you have any pain during that?
No, ma'am.
Okay. There was no nodes palpable, which is great. Can you open your eyes really big and your cheeks, puff out your cheeks? Okay. And then go ahead and close your eyes, and I'm just gonna touch your face, and you just tell me where.
Left cheek, right cheek, left forehead, right forehead, left chin, right chin.
Okay, great. So that shows me that your trigeminal, your facial nerve are all intact, and your can you bite down really hard? And do you feel any pain?
No, ma'am.
Okay, so your temporal muscles and your greater masseter is present. Do you wear glasses?
No, ma'am.
Okay. I'm going to have you close one eye with one hand, and just tell me what you see behind.
I see through the glass window there's trees on the campus.
Okay, and then go ahead and hold your other eye and tell me what you see.
There's a desk and a chair.
Okay, great. And I'm going to just look into your eyes real quick, and you can just look at my nose. Okay. All right. And then can I have you look up, and I'm going to look into your eye here. Perfect. So your eyes are pearl with 3 millimeter pupils. Your eye color is brown. Your sclera was white, and your conjunctiva was pink.
Okay.
There's no drainage. Your eyes are symmetrical looking at me. Can you follow my finger? Okay, great. Your accommodation is present, and your ocular and trochlear nerves are present.
Okay.
All right, and I'm just gonna look into your ears now. Okay. And then your other ear. Okay. And I'm gonna feel around on your ear. Tell me if you have any pain.
Okay.
Okay. Is that okay?
Yes, ma'am.
Okay, so there was no drainage and no foreign bodies in the ear. Your recoil was immediate. You do have ear piercings. And now I'm going to whisper a word into your ear, and you just tell me what that word is, okay?
Water.
Juice.
Juice.
Okay. Great. So that shows me that your vestibulocochlear are present. And then if I had an otoscope, I would go ahead and look into your ear canal, and I would see your tympanic membrane, that it is concave, shiny with a gray color coming back. Okay. Now I'm going to look at your nose here. Go ahead and just look up. Okay, perfect. Your nose is midline with no septum deviation present. Can you close one and then breathe in? Great. And then the other side. Okay, great. So your nares are open and patent. If I had a candle, I would have you smell it, and you could tell me what it smelled like, and that would show me your olfactory was intact. And then I'm going to just feel around on your sinuses here, and you just let me know if you have any pain.
No, ma'am.
Okay, great. And then your lips are symmetrical. They're pink and moist with no cracking. And can Can you open your mouth really big? Stick out your tongue. Okay, lift your tongue up. Perfect. All your teeth are intact. They're straight and white. Your mucosa is pink and moist. You had no tonsils present. Your uvula was midline. Your gag reflex is intact. Can you swallow for me? Okay. And your glossopharyngeal and your hypoglossal nerve are intact. Okay. As you were walking in, I looked at your gait. It looked steady. Do you have any ambulation devices that you use at home?
No, ma'am.
Okay, perfect. So I'm going to have you lift your shoulders up, down, okay, and then turn your hands towards me, okay, and this way, okay, and can you look all the way up, all the way down, and then to the left, and to the right? Okay, so your accessory nerve is strong and intact, and then I'm going to have you push up against my hand, great, and push down, perfect, squeeze my fingers, okay, and then same thing with your toes. I'm going to have you push up, okay, and push down, great. Your strength is equal bilaterally, upper and lower, which is great. And then I'm going to just come down here and I'm going to check your dorsal pedis pulses, your tibial pulse. You have no edema present. Are you able to feel my hands?
Yes, ma'am.
Okay. And then I'm going to check your radial pulse. Great. And your brachial pulse. Okay, great. And can you feel my hands?
Yes, ma'am.
Do you have any numbness or tingling in your hands or feet?
No, ma'am.
Okay. All of your pulses were great, steady rhythm, and there's no edema present, no lesions anywhere on your legs. Your skin tone is all within normal limits. And okay, so we're gonna check your chest here. I'm just gonna look at you. So you take a deep breath in and out. You have an even rise and fall of the chest. Your chest is symmetrical with no barrel chest present. I'm gonna check your spine here. Do you have any pain?
No, ma'am.
Okay, so your spine is straight and midline with a natural curve to it. And then I'm just gonna listen to your lungs real quick. Okay. Take a deep breath. Okay. And out. Okay. Deep breath in. And out. Good. Okay, perfect. I'm gonna check your anterior. Take a deep breath. Deeper. Good job. Okay. Okay, great. Now I'm just gonna listen on the side here. Okay, on this side. Okay, great. All lung sounds are clear with no adventitious sounds. There is vesicular sounds present in all lung fields. And I'm going to just go ahead and look at your chest here. Okay. There are no lesions, no hives, no or lifts or pulsations present. There's no skin tenting. And I'm gonna just feel around here. So your aortic is at the second intercostal space, right of the sternum border. Your pulmonic is at the second intercostal space, left of the sternal border. Your Erb's point is at the third intercostal space, left sternum border. And then your tricuspid is at the fifth intercostal space, left sternal border, and your mitral is at the fifth intercostal space, mid-clavicular line. Now I'm going to listen to your apical pulse for 1 minute. Okay. Okay, so your apical pulse was 72 beats per minute. It was a regular rhythm with no extra sounds, no murmurs, and your S1 and S2 are present. All right, and then if you can, just go ahead and lay back a little bit in that chair. I'm gonna just overall look at your abdomen. There's no distension present. And then I'm going to just look at your abdomen. Okay. There are no scarring, no piercings, no lesions present. Your umbilicus is midline. And now I'm going to listen to your bowel sounds here. Do you use the restroom okay?
Yes, ma'am.
Okay. Okay, so your right lower, right upper. Okay. So I'm gonna just feel around. So your right lower has your large intestine, your small intestine, and your appendix.
Okay.
Your right upper has the liver, gallbladder, duodenum, intestine, and your pancreas.
Okay.
And then your left upper has your stomach and spleen.
Okay.
And then your lower quadrant has your descending colon, transverse colon, and your rectum.
Okay.
Did you feel any pain on palpating your stomach or any of that?
ma'am.
Okay, and then lastly, I just want to ask you, do you know how to conduct breast exams at home?
Yes, ma'am.
Okay, so can you give me an example and show me the motions that you would use?
Yes, ma'am. So I can either lay down or sit up. I would use a sweeping, circular motion or a palpable motion, and just kind of feel around the breast tissue and up into the arm.
Okay, great. Do you have any questions about anything we went over today?
No, ma'am.
Okay, thank you so much.
Thank you.